this video the 3 fastest protocols ever published to get end-stage patients to stop the machine for good. Catherine here, Doctor of Natural Medicine. For most CKD patients, the Big D machine is a life sentence. But for a lucky few, it isn't. Today, we will talk about those who were able to stop it, to escape dialysis even after several years. And guys, I am not talking about a transplant or futuristic stuff like stem cells or a kidney from a pig. I am talking about natural interventions prescribed by some of the top nephrologists in the world that patients in all the stages can use to heal. Yes, today we are going to see 3 specific protocols fully documented in medical literature that can stop the machine fast and that your doctor knows absolutely nothing about. Because here's the thing, these protocols are so effective, dialysis clinics are actively trying to stop the researchers who are publishing them. No, I'm not exaggerating. Look at this study published on a peer-reviewed journal. Here's what it says. 2 weeks after we terminated the patient's dialysis, the doctors at the dialysis center complained to the Nephrology Association and requested them to open an investigation against us. I mean, are they for real? Instead of building a statue for a team who is saving patients from the machine, they launched an investigation against them? And that is exactly what I am exposing today, because they might silence a doctor, but they cannot delete the science. I mean, unless YouTube mysteriously decides to censor my video, and then it's over. So yeah, maybe watch this video right now while you still can. Now guys, a quick warning before we start. This is for educational purposes only, alright? Escaping the machine is not a DIY project. But that doesn't mean you can't learn from the survivors who did it. Okay, let's get on to it. Let's start with our number 3 for today. I call this one the Italian way, and this is all about Italian nephrologists getting their patients free from the machine using pasta. Yeah, I'm not joking. This is easily one of the most mind-blowing protocols out there, and it's going to be very interesting for everyone because you can safely use it in all the stages of CKD to delay dialysis. This protocol is very similar to the treatment I personally use to get my patients to delay dialysis. What's new about it is that these researchers are now using it to get renal failure patients off dialysis. It's true, take a look. In this very recent paper, 2 elderly patients were saved from the machine for good. They weren't able to tolerate dialysis anymore and they went to their doctors for help. Now, what your nephrologist would have told them is to start making a will. But they weren't seeing your nephrologist. In fact, instead of being sent home to fade away, these patients were given actual targeted treatment and a diet. I know, shocking, alright? So question, what happens when end-stage patients unplug the machine and actually have a brilliant medical team backing them up? Look at the screen. Both of these patients are still thriving today, 2 full years after throwing their dialysis schedules in the trash. And get this, they are actually doing better than when the machine was keeping them alive. Yeah, this is the power of this protocol. Guys, this is hard, peer-reviewed science. I am not making this stuff up. Look at the study. Survival beyond 24 months, improvements in metabolic complications, better quality of life, fewer hospital visits. That is the exact opposite of what you'd expect when you quit a life-saving treatment, right? So this breakthrough was published by a team led by a brilliant Italian professor of nephrology from the University of Padua, Dr. Francesca Martino. Now guys, I will show you how the protocol works in a moment. Before that, I want you to read what the authors of the study think about dialysis. Because here's the thing. These Italian doctors, they are sick and tired of patients being shoved into dialysis without being given an alternative. They think dialysis is overrated and that it's not always necessary. But they are not just saying that many patients don't need the machine. They actually proved it. So kudos to this Italian team for proving what many of us have been saying for years. Okay guys, let's go from theory to practice. How do you even stop dialysis with pasta? Well, this study explains how to do that in details, starting with the most important part, the diet. And guys, take a good look at the diet described here, alright? This is very, very up to date when it comes to the renal diet. It's actually very similar to the diets I prescribe my non-dialysis patients. And since I actually use a diet based on the same set of rules they describe here, I can actually show you how it works. So, you should be able to see all the important numbers of this diet on screen right now. Potassium, phosphorus, calories, protein, and these numbers are exactly what they are using to get patients off dialysis in this paper. And they also work to delay dialysis, sometimes by years in patients in stage 4 or 5 pre-dialysis. Now, this is a very low protein plant-based diet, alright? Protein intake is going to be 0.3 to 0.4 grams per kilograms of body weight. But what does that even mean? How much protein are these patients eating every day? Well, this is basically like eating zero protein, alright? No meat, no fish, no dairy. This is a pretty extreme diet, and this is exactly where that magic Italian pasta comes to the rescue. To hit that near zero protein target, you have to swap regular food for upper-take, protein-free pasta and bread. And here's the thing. In Italy and various other countries with universal healthcare, low-protein diets are routinely prescribed to CKD patients who want to delay dialysis. Why? Because when you reduce protein intake, the amount of work your kidneys have to do is reduced immensely. And this is why, if you have kidney disease and you are in Italy, the government gives you free upper-take pasta. Some patients are walking away with 12 kilograms of free upper-take pasta and baked goods every single month. Why? Because saving a kidney with specialized food is infinitely better and cheaper than hooking someone to a machine. If you have CKD and you are trying to delay dialysis, you absolutely must get informed about the low-protein diet. Now I know exactly what you are screaming at the screen. Catherine, isn't eating just pasta unhealthy? Won't I lose all my muscle mass? Well, here is the plot twist. You don't lose muscle just from cutting protein. You lose it from starving your body of calories. And it's not the same thing. In fact, the patients in this study actually improved their nutritional status and gained muscle mass by cutting protein. It's true. Science proves we can completely block muscle wasting in CKD patients just by ensuring they are eating enough calories and by using a special supplement. And that is exactly what this upper-take pasta does. It gives you a massive energy fluid with zero toxic kidney load. But there is a catch. When you cut out meat, fish, and dairy, you are also cutting out the critical vitamins your body needs to survive. You must supplement. So let's talk about the supplements that patients on a low-protein diet need. First of all, you need a high-quality renal multivitamin. And if you need a multivitamin, you want the best. I am talking about Rena Best, the multivitamin I formulated for my patients. When you are on a renal diet, your levels of vitamin B12, iron, and vitamin D will absolutely crash if you aren't careful. Rena Best acts like a biological shield, flooding your system with the exact safe levels of iron, active B12, and vitamin D you need to prevent devastating anemia and protect your kidneys. If you want the best renal multivitamin, head over to renabiotech.co or click the link below and get your daily armor right now. And let's go back to the study now, because the other supplement used here is, of course, keto analogs. Think of keto analogs as ghost protein. They are specialized amino acid supplement prescribed to CKD patients. They give your body the exact building blocks it needs to maintain muscle, but without generating the toxic urea waste that destroys your kidneys. The best part, other than avoiding dialysis? Well, the best part is that if you follow the calorie match and take the right supplements, the fear of losing muscle mass is totally busted. So this is exactly how these patients were able to stop the machine. Very low protein diet, a few targeted supplements, and the help of competent doctors. Alright, let's address the massive elephant in the room now, fluid control. Because here is the massive catch. Both of the Italian patients we just talked about were still making a decent amount of urine before they unplug from the machine. But what about the patients who are not making enough urine? Well, this is exactly where we examined the groundbreaking work of our next brilliant nephrologist. Number 2, let's talk about the Toprak kidney protocol. Let's go from Italy to Turkey and take a look at the work of Dr. Ömer Toprak, an elite nephrologist from Turkey. And here's the thing, while the Italian team just started using their method to get patients off dialysis, Dr. Toprak has been doing it for more than a decade. He is also good at saving patients from the machine that dialysis clinics are actively trying to stop him. Look at one of the last peer-reviewed he published. The dialysis center complained to the Nephrology Association and requested them to open an investigation against us. I mean, guys, this is frankly shocking. And by the way, I don't think Dr. Toprak is going to publish more studies, but I hope he is still saving patients. Anyway, how exactly is Dr. Toprak pulling his patients off the machine? He engineered a highly specific gut-focused diet. It aggressively flushes toxins straight out of the digestive tract, meaning his patients don't have to slash their protein intake as much as the Italian protocol requires. And here is the absolute mic drop. His protocol successfully unplugs patients even after they have been trapped on the machine for years. Look at your screen. That is Professor Toprak interviewing his own patients. Every single one of them managed to escape dialysis even after years of being dependent on it, which is still considered almost impossible in standard medicine. Dr. Toprak actually has his own YouTube channel, but it is entirely in Turkish. If anyone wants the link to risk it with an AI translator, drop a comment and let me know. Anyway, let's rip the lid off his protocol and see exactly how it works. At the very core of his protocol is the jujube fruit, also known as the Chinese date. Dr. Toprak uses jujube extract, juice, and raw vinegar because it acts like a biological wrecking ball against kidney disease. It crushes hypertension, blocks diabetes, and literally restores kidney function according to one of the top nephrologists in the world. But more importantly, it is a heavy-duty natural laxative. Why does that matter? Because if you want to escape the dialysis chair, you must turn your gut into a backup kidney. It is the only way to physically dump uremic toxins without a machine. That is exactly why Toprak's patients consume jujube and raw jujube vinegar every single day. But the protocol doesn't stop there. Look at my infographic. They flood the gut with heavy-duty probiotics using real sauerkraut and other probiotic foods. Just 2 tablespoons of raw unpasteurized sauerkraut can pack up to 10 million colony-forming units. Now, eating raw sauerkraut every single day is great, but it's also exhausting. If you want to skip the hassle and still flood your gut with 30 billion specific kidney-saving strains, you can also try my Renobiotic from renobiotech.co. Because here's the thing, Dr. Toprak protocol is all about getting renal toxins out of your gut, and he does it with probiotics. Now, like I was saying, Dr. Toprak has a secret weapon against fluid retention. When fluids build up, they trigger massive swelling, skyrocketing blood pressure, and catastrophic heart failure. So, how do we drain this water when the kidneys are totally offline without using a machine? Well, with one brilliant trick. He turned their skin into a third kidney through aggressive sweat therapy. When you sweat heavily, you aren't just losing water, you are aggressively flushing out toxic potassium, sodium, and heavy urea. For a patient trapped on a dialysis, that exact mechanism is completely life-changing, especially if combined with probiotics and a renal diet. Now, there is one last very important step to the protocol this nephrologist uses. with his patients. Let's talk about medications. Dr. Tuprak found out that most of his patients were using medications with severe side effects. The standard medications most CKD patients take, like PPIs and metformin, are silently nuking their gut microbiome. When the good bacteria die off, toxic bacteria take over, driving up massive inflammation and sending your kidneys into a violent spiral of self-destruction. And that's not even the worst part. Many of the standard prescriptions most CKD patients take become completely toxic once you hit stage 4 or 5. Look at this table. If you are in late stage CKD and still taking potassium-sparing diuretics like spironolactone, you need to call your nephrologist immediately. Now guys, the protocol this doctor published is intense experimental medicine. Do not try to sauna your way out of dialysis without your doctor's strict supervision. But this proves it can be done. Now guys, let's talk about our number 1 for today, and I've kept the best for last. There is another eminent professor whose work I've talked about extensively here on Double Kidney. This doctor, his name is Amir Al-Masawi, and he is a pediatrician from Iraq. And what he developed is probably the fastest and simplest protocol I've ever seen to replace the machine. He calls it intestinal dialysis, and it works by administering just one supplement in combination with a low-protein diet, of course. But the results can be so incredible, he started taking ultrasounds of the kidneys of his patients before starting the treatment, just to prove that they were really end-stage chronic kidney disease patients, and that they weren't just suffering from, an acute condition. He needs to do that because the results he is getting are extraordinary. Look at this. In just 1 week, this patient got his creatinine from 4.5 all the way back to 1.1. Guys, this man went from needing dialysis 3 times a week to creatinine so low it's considered normal. So question, what's the miracle remedy that was used to achieve this result? He calls it powdered acacia gum, but you might have heard about it as Reno Fiber. Yes, my fiber supplement is the same exact remedy this doctor is using to get his patients off the machine. If you want to learn more, I've made a full video about this. It's up here and also down in the description. And this is all for today. Thank you for watching. God bless you all. Bye!